Dear colleagues, this is a hypermature cataract done in subconjunctival anesthesia, making the paracentesis, placing some trypan blue to stain the capsule, and then we're using the grease rubber forceps. I'm able to fashion around capsular axis. You notice that I always incise the anterior capsule with the knife when I do the paracentesis, so I have the start on this capsular axis, and that's the place where I'm placing the grease rubber forceps and start the capsular axis. Some fluffy cortex here, but the pressure inside the anterior chamber is well maintained with the AC maintainer, and I'm able to finish pretty safely the capsular axis, making the main paracentesis and starting the phacoemulsification. I'm doing horizontal chop on this case. Using this long chopper, it's very easy to crack the nucleus. This is a soft nucleus, even though the cataract is hypermature one. The nucleus is kind of a fluffy one. It's not very leathery or anything like that, so it's very easy to crack and aspirating in smaller pieces, and it's very easy to emulsify. We don't use so much ultrasound in these cases. Making sure the pieces are well separated for better maneuverability inside the bag, using the phacoemulsification probe bevel down to ensure the aspiration of the nucleus, and it's raising the efficacy of this procedure, of these maneuvers, keeping the bevel towards the part of the nucleus that we want to emulsify. Of course, modulating that from the foot switch, and we are able to finish half of the nucleus, emulsifying it, and then cracking the other half in smaller and smaller pieces, and easily having that taking it out of the eye very fast and safe. The last small particle of the nucleus, or at least that's what I was thinking, that's the last part of the nucleus. Washing out the viscoelastic, and it's a lot of viscoelastic inside the anterior chamber, so that's good, protecting the cornea. That means we don't have so much fluctuation to the anterior chamber, and phaco time was very small. Washing out and polishing out the anterior capsule, polishing the posterior capsule a little bit, and then injecting the IOL. It's funky unfolding of this hydrophilic IOL. The cartridge rotates that IOL, but it's no big deal. With the chopper, I'm able to place both haptics inside the bag and rotating into the right position. The other haptic, the first haptic, it was unfolding it under the iris, but on top of the anterior capsule, so I placed that also into the bag. And usually after I'm washing out the viscoelastic from the back and on top of the iris. I'm pressing a little bit the iris down so I break the anterior synechia on this hypermature cataract. And something looks funny. The iris is kind of a bulky one right on this area. So if you feel that something is wrong, it is. So this last part of the nucleus got hidden behind the iris. I took care of that also. Thank you for your attention. Hope this will help you in your practice also. So always keep in mind that you have to be with sharp attention until the last second of the surgery.